hoping we can do for you about that?
I don't think, doctor.
Yeah.
Maybe if it will go away, I will feel better.
Yeah.
Yeah.
Of course. Look, the door's always open. If things get worse mentally as well, and you feel really down, and I know it's affecting your self-esteem, we can speed up the referral for you. Okay. And so you can see a specialist. But I really want you to know that the first line really works. Okay. And you can always make a follow-up if things are getting really bad psychologically. There are, psychological help available, as well as specialist-led treatment that can maybe, but because it's so mild, you may not need a specialist, and these medications would work. Okay, so let's see in 3 months. Do you think you can wait for 3 months?
Yeah, doctor, if it will help, I'll definitely wait. Yeah.
Anytime, if you have any concerns, feel free to come back even earlier. Just make an appointment with us and we'll have a look at it. Okay.
Thank you, doctor. Thank you so much.
Fine, that's great. Do you have any other questions?
No, no, not at all.
Okay. All right, that's good. So all the best at school. You know, there's definitely a leaflet I can give you. Have a read. It's not about hygiene. And if people are troubling you at school, listen, you can speak to your teachers, parents. Move on to the next station. You can speak to us as well.
Because it was a 15 years old, you did really well. You were listening and you were really calm, like for the 15 years. It was really good.
Thanks very much. I know 15-year-olds. Yes.
Yeah.
So, there we go. There we have it. I mean, that's what it looks like for something like acne, right? So usually when in the exam, if you had look at my forehead, doctor, then they'd probably put the picture out before you even get to examination. So just be fluid and have a look. Actually have a look. Right? Yeah, I can see. So you already know it's probably acne. Other than that, any other feedback there?
Anyone on me?
Yeah. Or any questions at all? Let's have a look. Doc, are you supposed to ask the P-bind? For a 15-year-old, no. You don't ask P-bind for a 15-year-old. For a 15-year-old, you don't really do much but ask past medical history, medication, allergies, and any problems like that. Now, the rash wasn't, a recent onset rash. The immunization and things like that didn't apply here, but it's going to apply soon. Okay. What is P-bind? Ooh, let me write it down for you, doctor. Okay. P-bind is, P stands for pregnancy history. Okay. How was the pregnancy? If it's a female, you need to do the periods, but if it's a male, you don't need to do the periods. Yes. And COCP as well. Okay. So how much age we ask P-bind? Usually you ask P-bind until 10 years old, 11 years old, like, those kind of ages. Okay. So pregnancy history, birth history, B is for birth history. Okay. I is for immunizations. N is for nutrition. And D is for dehydration. No, sorry, development. What am I saying? D is for development. Okay, D is for development. How's he developing? Are you happy with your child's development? Again, the younger, the more relevant. You can, save yourself some of these. If they get above the age of 8 to 10, then all of a sudden you don't really need it as much. Again, please, guys, stay fluid in your history taking. Do these things actually, because you'll realize that, yes, a history taking performer is one thing. Doing it is slightly different. Again, scripts. If you're reading scripts, hello, doctor, how are you? I'm fine. That can lead you to not developing a spontaneous way of addressing and dealing and a cerebral way of understanding your approach. So practice makes perfect for me. Next we go. Okay. What do we have? We have a 28-year-old female. She came with a rash on her face. Okay. The rash, I couldn't find a female one, but it's going to look like this, but on an older female. Okay. So I think everybody knows what that looks like. Yeah. Everybody knows what that looks like. So that's going to be the scenario. What you obviously need to do again is the same history. Okay. She's going to be a bit upset because she's tried over the counter and it's not helped. Okay, she had a few days after the swelling developed, she started getting blisters. Now, my voice is getting really, really dry. So after the break, we'll do this one and more. There's still more to do, a lot more. And you today also falls history is left, and false scenarios, and obviously confusion, like due to oxybutynin, hyponatremia, different confusions as well, and dealing with someone who's anxious, an anxious patient. For the dermatology, we still have genital warts. We still have many other ones. We've covered all of the important ones to get how to take a history correctly today and manage in 8 minutes. But in the masterclass, newest, latest scenarios and practices for them as well will be upcoming. But we're doing a lot of the new ones here as well. So see you in about 10 minutes. Okay, so it's 11:10. We start again 11:20 a.m. Your feedback is very useful, guys. So if at any point you would like to know something or have questions or anything, please let me know and I'll be able to answer that for you. Thank you for joining, and it's my pleasure to be here. Hi guys, we're back. Okay, we are back. Okay, just give me a second. I apologize, guys. Sorry, I know I'm 2 minutes late. I don't like being late. So, we continue. We don't stop. We continue. That's the way it goes. Okay. We've got one right here. Just checking, mic check. Dr. Nida, thank you so much for your contribution and being here. Really appreciate it. But please introduce yourself to everyone because I feel like that's pretty rude. I haven't done introductions today.
Oh,
Meet yourself.
so I'm Nida Zara, and I've done like PLAB 2 years back.
Yeah.
Just doing the locum jobs here.
Yes.
A short introduction.
Thank you. Got a lot of experience in there, yeah?
Yeah. So
Yeah.
I've been teaching, the PLAB. I've been guiding a lot of doctors. So
Yes, I remember. I know very well. That's why we have you here. Thank you so much. Yeah, so guys, we keep at it. Here is the scenario that I'd like you to be the patient for this time. Okay. So you're a bit frustrated. You're not angry, but you're a bit frustrated with everything at the moment because you went to the pharmacy and they gave you some topical creams, but they didn't help me at all, doctor. So I've got these blisters in the corner of my mouth and around the margins and everywhere. Okay, something like that. Good. I'm sure we all know what the DDs could be, but we're going to try and do it together. All right, 3, 2, 1.
Begin. Enter the room.
Hello. Hi, my name is Dr. Radwan Ali, and I'm one of the doctors here in the GP surgery. Can you just confirm your full name and age, please?
I'm Lita, doctor, and I'm 28.
And you're 28 years old. Okay, what can I call you today?
Lita is fine.
Okay, I understand that you had a rash on your face you were concerned about. Can I know more?
Yeah, doctor, actually, there is a rash on my lower lip and, the angle of my, the sides of my mouth.
Lower lip, sides of your
Yeah,
mouth.
you
Okay.
know.
All right. Is it just one rash or is it more than one all over?
They're blisters, doctor. There are a couple of them, not just
Okay.
one. Yeah, it's all over the lower, yeah.
Okay. And may I ask about the color?
Um, it's like a pussy color, doctor, like a red and a bit blisters.
Okay. Any crusting?
No,
Okay. Any ulceration at all?
no, doctor.
Okay. When did you get the rash, the blisters? Sorry.
A few days back.
Okay, you got it a few days back. 2 days, 3 days, exactly how long?
Uh, Doctor, actually, I have this for 1 week now,
Okay.
and I'm quite frustrated, to be honest. at this point because I went to the pharmacist and, he just gave me the a topical cream.
Okay.
And now, they are just very bad now. It's like few days that it is just increasing now. And that's why I'm
Getting
here.
worse, eh?
Yeah.
Is it getting worse?
Yeah, yeah. Like it's quite, you can see that it's so bad. Yeah.
Okay. Yeah. Yes, yes, definitely. When the rash first started, where did it start on your face? And was it the sort of thing that came suddenly or gradually?
Suddenly, doctor, it started from the lower lip and then the angle of my mouth. Yeah.
Okay. So it really spread, didn't it?
Yeah.
Okay. And did it spread over days or weeks?
Days, doctor, it just happened
Over
1 week
days.
back and now,
Okay.
yeah.
Okay. You mentioned that they're red. Has it changed in color since it, or
No.
was it a different color before? Did it become red now?
No, doctor. It's just spreading. Yeah. Yeah.
Okay. Just a few questions about symptoms. Do you have any other symptoms? Pain, perhaps?
Uh, yeah, they are painful.
Okay. Is there
Not that painful, doctor. Sorry. No, they're not.
okay, not that painful. Okay. You mentioned blisters, right? Have they popped at all? Was there any discharge?
No.
No discharge whatsoever. Okay. That's fine. Okay. And before you developed the rash, did you have any symptoms, any flu-like illnesses before that?
No, doctor. No.
Okay. Nothing like that. Okay. And generally, how you're doing? Any headaches?
No, doctor. No, that's
Any
fine.
fever?
No.
Okay. Any rashes in your mouth or ulcers in your mouth?
No.
Nothing like that. Okay. Any lumps or swellings anywhere else? For example, your private areas or anything like that?
No, doctor.
Okay, okay. And in situations like this, when and also does happen on the mouth, it's important I do ask some personal questions about your sexual life because I have to cover all the bases. Is that okay with you?
Yeah, that's fine.
Okay. Are you sexually active?
Yeah, doctor.
Okay. And is your partner male or female?
Doctor, I'm married for last 3 years.
You're
I
married for,
yeah.
okay, you're married for the last 3 years. Okay. And is there any chance you've had more than one partner in the last 6 months at all?
No, doctor, not at all.
Okay. And may I ask, what kind of sexual practices do you partake in?
Everything, I would say. Yeah.
Okay, okay. That includes oral as well.
Yeah.
Okay. And have you noticed any symptoms in your partner at all?
Oh, actually, no, doctor. No, no, no. He's not
Okay.
having.
Any swelling or in the private areas or ulcers in your partner?
No, doctor.
Okay. All right. Thank you so much. That's very helpful for me to understand everything. I really do appreciate you taking the time to answer my questions. Thank you for coming in. Do you have any medical conditions?
No, doctor.
Okay. Are you on any medication at all?
No.
Are you allergic to any medication?
Yeah, doctor. I'm allergic to penicillin.
You're
Penicillin.
allergic to penicillin. Okay, that's very important information. Thank you. Are there any conditions that run in the family?
No, doctor.
Okay. Do you smoke?
No.
Okay. Do you drink alcohol?
Just a glass of wine every
Okay.
other day, not
All
regular.
right. Okay. Thank you very much. Have you traveled abroad recently in the last 6 months?
No, doctor.
Okay.